and what it looks like for us as school counselors in the workplace. Now, when I initially thought of this presentation, I thought of the workplace as our school buildings. And then COVID happened and everything else happened, and our workplace has shifted from schools to home. Now, as school is approaching in the fall, many of us are unsure as to where our workplaces will be, which can cause a lot of stress, amongst other things. And we'll talk about the whole shebang during our conversation this morning. But I just want you guys to think of this think of workplace wherever it is that you may be. So workplace may be in your school buildings, workplace may be in your living room, or in an office in your bedroom. It may be at a co-working space. So think of workplace in general. Don't think specifically about school building, because that may not be where you are going to be this school year. So before we get started, just a quick bio about myself. I am from New York. I was born and raised in Brooklyn. So those of you guys who are New Yorkers, Brooklyn, stand up. I have a doctorate in education in counselor education and supervision. I'm currently an assistant professor of school counseling, and along with teaching school counseling coursework, I also help school counseling students navigate fieldwork as the practicum and internship coordinator. I have a background in special education and school counseling. I'm a nationally certified counselor, an LPC in the District of Columbia, so I do some mental health work. I'm an approved clinical supervisor, so I do supervise mental health counselors, post-grad, as well as school counselors. I work online as a telemental health practitioner. I do some small work for ASCA as their special interest network facilitator in the area of supervision. And I work as a mentor with the National Board of Certified Counselors. So I work with mental health and school counseling students who are going through the scholarship program. So really quickly, because I know that many of our cameras are off, I just want to say thank you to everyone who's taken time out of their busy schedule to come and attend my session, as well as my colleagues' sessions, because what we're saying is really important, not just to our group, but to the profession as a whole. So we all, I say this on behalf of all of us, we really appreciate you taking time out of your schedule to come in and chat with us and really take in all of this information. So school counselors, those of you who are current school counselors, those of us who are students and interns, our counselor educators and supervisors, directors and coordinators at the state, school, and district level, those of you who are just mental health counselors or part-time mental health counselors, other school behavioral health personnel, and any others who don't fit into those aforementioned categories, we thank you and appreciate you for showing up. So part one, what is self-care? I think before we talk about workplace wellness, it's really important to really have a working definition of what self-care is. So we're all on the same page, right? So self-care is the practice of taking action to preserve and improve your health. So whether you're establishing or maintaining or trying to make it better, it is taking that action, and that's what we call self-care. As school counselors, we are helping professionals, and so we spend the majority of our time at work caring for other people. Even though our training tells us that we care for our students and that we're concerned about our students and those positive outcomes, we know, because of the roles that we do, we don't just work in a box. We don't just work for our students or with our students. We support and care for our stakeholders, right? Including our parents, our teachers, our admins, and those within our community. Because the nature of our work causes us to collaborate with so many other individuals, that caringness really extends to all of the people that we work with in order to support our students. So we do a lot of heavy work. Why self-care? Why are we even having this conversation, you ask, right? Because it should be something that we should know. It's something that's just automatic. As school counselors, we should know that we can't pour from an empty cup, right? Well, let's start with our profession. ASCA's ethical standards, which surprisingly a lot of people don't know, our ethical standards say that we are to monitor our emotional and physical well-being, right, to ensure that we are providing the most effective services to our students. Additionally, it also says that we need to go out and seek support when needed to ensure that professional competence. Additionally, the ACA Code of Ethics, right, because we also look at the American Counseling Association's ethical standards, and their standards extend also to students and supervisees, so not just counselors. Now, ACA talks about monitoring and seeking support, the same things that ASCA talks about, but then ACA takes it a step further and says, if necessary, we limit, suspend, or terminate our professional responsibilities until it's determined that we can safely resume our work. And for a lot of us, we can't just stop working, right? We have to pay the bills. And so many of us don't necessarily, I don't want to say that we don't step away, but we find ways to limit, right? Or we find ways to work around this piece. Because again, some of us just can't walk away from work. If you are the only provider in your household, or if what you're contributing to your household is helping to keep it afloat, you can't just walk away. However, for you to limit student harm, for you to limit more harm to yourself, it's important for you to, again, seek that professional assistance before you reach that level of impairment. And if you do reach that level of impairment, really weighing the pros and cons to see if you do need to step away. Some of us do take FMLA. Some of us do take mental health breaks, right? It's not something that is out of the ordinary, right? And to each its own. I'm not telling you to go and tell your principals that you're stressed out this summer and that you're not starting back at the beginning of the school year because you're going on FMLA. That is not what Q is telling you to do. However, you really need to be able to assess yourself and see where you are and really tap into what you need, because you really can't be good to anyone else if you are not good for yourselves. So, the need for self-care as school counselors, really narrowing it in a little bit more now. So although we as school counselors talk to people about self-care, we can articulate it, we know about self-care, believe it or not, the literature says that we are not connected to self-care. We're disconnected when it comes to knowledge and action. So we know about it, but we're just not doing it, okay? Also, our unique positions in schools, it requires us to wear many, many hats. And y'all know what I'm talking about, because some of these roles and responsibilities that we have are non-school counseling related, our fair share responsibilities, right? So because our roles require us to wear multiple hats, some of those hats include ethical and legal issues, right? Let's talk about the child maltreatment and the calls that we have to make to child protective services, right? Dealing with parents who are divorced and trying not to get into the middle of custodial parent issues. Dealing with all types of legal issues and ethical issues can really weigh down on us regarding our wellness. And so because we wear those multiple hats, we need to make sure we're tapping into that self-care. We also engage in labor that's emotionally charged with a lot of high demands, and we're often not replenishing ourselves. So when you have a student crisis, when there's trauma in your building, when there are mental health concerns, we're doing a lot of that emotional labor and we're depleting ourselves without replenishment. So we're not giving back to ourselves. It's kind of like running a race and not stopping to take a break, not stopping to drink water. You don't replenish yourself, of course you're going to deal with stress and burnout and impairment, which in itself can lead to ethical and legal issues. Last but not least, for those of us who are not familiar with clinical mental health counseling programs, our sister profession, those of us who have gone through clinical mental health counseling programs, in order for us to be licensed as clinical mental health counselors, we typically have to complete a certain amount of post-grad hours in the thousands. And with those post-grad hours, we are also under supervision of a licensed counselor. So we, most of the time, can't even sit for an exam or get the license without having the hours and the training first. In the school counseling profession, that's very, very different, right? We graduate from our programs, we immediately start looking for jobs, and we get hired and we work. Most of us don't have access to a supervisor. So without that supervisor, we don't have that personal and that professional support. We don't have that emotional support when we're dealing with a student crisis or a student issue. We don't have that senior member to offer us that consultation that we'll need. And let's face it, many of our administrators in our schools, our principals, assistant principals, they don't have a background in school counseling. So going to them to help you process through an issue, they may or may not be capable in doing that because they're not necessarily viewing these issues through a school counseling lens. So where do you really get that support? Why is self-care more relevant now more than ever? Why are we really having this conversation right now? Let's get into it. First of all, we are in the midst of two public health crises, right? We have COVID-19 on one end, and we have racial trauma and systemic oppression on the other. Now, even though COVID-19 just kind of reared its head here in the States this year, we've been dealing with racial injustice forever, right? We've been dealing with that forever. But now having the two coupled at the same time makes it even worse, especially for educators. Okay, so I'm not sure how many of us are consistently on social media, but there's a story that just kind of is in the news about the teacher who died from COVID-19. She was working in a school with two of her colleagues. The three of them contracted the illness, and she died. She was in her 60s. She had pre-existing health conditions, but that kind of brings things home for us as school counselors when we think about the fact that we may end up back in schools this year. Now, mind you, this was 3 people. All right, when some of us have a classroom of 25 to 30 students, okay? So it's kind of scary to think about that. Additionally, there are other states and other places, especially New York City, which was the epicenter of the COVID crisis, where, teachers and other educators were getting sick and dying, right? So this is not something to play with. It is very real, and it's really rocking our educational system. So it's something for us to definitely pay attention to. And of course, in paying attention to that, it sometimes causes anxiety. Let's think about it this way. You have no direction or guidance right now from most school districts regarding reopening and reentry. You have some school districts who are trying to weigh the pros and cons between a hybrid model and just fully virtual. Some of us educators are parents. We're trying to figure out how we are going to be able to work, because some of us are working from home, and how to support our kids online, right? So we're juggling with that. The government is in disagreement with the CDC and WHO, right? Who are those two organizations that are really giving us information about this pandemic. And then, of course, the government is demanding that schools reopen, right? Our education secretary, our president, they're demanding that schools reopen this fall. And so that brings about a lot of confusion. It brings about a sense of anxiety, panic, and fear, because we really don't know what's happening. And we are unfortunately forced to choose between living our lives, right? Or working and making money. Because for some people, that's what they're weighing on a scale. Do I quit my job and not have any money and try to figure this out? Or do I go to work and risk getting sick and making others sick, right? And that anxiety in itself would be a cause for self-care. Um, not knowing what your health is going to be like, not knowing the people that you're going to be around. And we love our students, right? But we see in the news that younger people are contracting this illness. And I'm not here to kind of incite fear or anything like that. I'm just keeping it real. You just don't know. There's a reason why the CDC is telling us to constantly wash our hands, to wear masks, to social distance, right? But then, of course, you have students in your classroom. I saw a meme the other day, like a cartoon or a political cartoon or something, where there was a student who was raising their hand that said, "Teacher, he's teasing me about my mask." And then another student had like the mask on their head. The students were doing tons of things with these masks, but what the picture was trying to tell us pretty much was that it's going to be chaos in our schools, and not just with the masks either, but just social distancing in general. And again, that alone can cause issues related to stress. In addition to what we're dealing with in our schools regarding the pandemic, we can't ignore the fact that there's disparities in our healthcare, okay? COVID-19 has definitely showed us and revealed and demonstrated to us what those deep-seated inequities in our healthcare system looks like, okay? And we know that for communities of color, we are being hit hard with COVID-19 in comparison to our white counterparts. And not saying that our white counterparts are not being hit. I mean, everyone's being hit, right? But the fact remains that in terms of healthcare, we don't have the access that we need to testing or care, and many of us are dying because of it. We are as people of color, we are at increased risk to contract and die from COVID-19 because of serious issues that exist, right? Let's think about our diabetes. Let's think about our asthma, right? And our respiratory illnesses. Let's think about our hypertension and obesity in comparison to our white counterparts, right? These numbers are high in our community. Let's talk about the fact that many of our students don't have access to a usual or consistent source of medical care, right? Many of our parents don't have insurance or they're underinsured. Sometimes there's a lack of access and care. And so sometimes people may not even have access to testing. Let's think about the fact that many of our parents in our schools, especially in some of our low socioeconomic communities, many of them work in the service industry. They don't get to choose whether or not they go to work. Those jobs are their livelihood. They have to work to make a living for their families, okay? And they can't risk that loss of income. But at the same time now, they're also at increased risk because it's hard to social distance when you work in the service industry. Some of our students in our low socioeconomic status communities, many of them live in multi-generational households. Some of them live in public housing. And in these instances, it becomes very, very difficult to social distance and self-isolate. Last but not least, many of us work jobs that are not amendable to telework. Many of us have to use, especially in New York City, many of us have to use public transportation. And so it's important for us as teachers to recognize this, as many of us are in those situations and many of our students are coming from those situations. So it's important to recognize that as well. I saw this online, and it just kind of drove home the point of the anxiety that we're experiencing as it as it relates to this whole pandemic, right? So I've seen the version online with teachers. I saw the version online with speech and language pathologists. So I decided to kind of um, tailor this one to the work that we do, right? Because we all have questions. There are tons of questions that we have related to what's going to happen in our schools when we return, right? And one of those questions, at least for me, would be, okay, well, if I'm sick, am I going to have covered leave? Are you going to exhaust all of my sick days? So when I come back, am I not going to have any? Am I going to get paid while I'm on leave? So that way I can also pay my bills, right? These are valid questions. Okay, and what if I am sick and I have 5 classroom guidance lessons or groups or individual sessions per day? Does that mean that all the students that I've exposed to this, do they now quarantine and stay home for 14 days? What about substitutes? Because we know that there are schools where there are no school counselors at all, but for some school districts, they do have subs. Is a sub really going to want to work at a school after learning or hearing about what just happened with the previous school counselor and the fact that students have been exposed? Are we as school counselors going to be privy to information if students live in households with an individual who's been exposed or has contracted the illness, right? Or is that going to violate HIPAA? It's really important to think about these things and how stressful it is to us and the work that we do. How are we going to be able to support students and positive student outcomes if our wellness and our well-being is in jeopardy? How are we going to be able to provide quality services if we ourselves are filled with panic and anxiety and depression? Because let's talk about it. Many of us know people who've been sick. Many of us have lost people because of this. I know people personally who have died because of this, right? I'm a professor. I teach students, and I have students who are sick. Like, this stuff is real. And so even though our work requires us to be those helpers and to be caring, we also have to think about our own self-care, driving back that point home about our own wellness, because we can't do what we're supposed to do if we're not able to take care of ourselves. And it includes this as well. All right, and the other public health crisis that we're we're dealing with at the moment is the racial trauma and the systemic oppression that is embedded into the fabric of this country, okay? The data says it, and has always said it, right? Black women are up to 4 times more likely to die of pregnancy-related complications than white women. Black men are more than twice as likely to be killed by police than white men, okay? The average life expectancy for African Americans is 4 times lower than the rest of the United States, okay? So being Black is a public health crisis, right? And in thinking about that, as educators, if you're a Black educator, or if you are an educator that works with Black students and families, this stuff applies. This stuff applies. There are currently 3 states and several counties in so Michigan, Ohio, and Wisconsin, along with 20 cities and some other counties, including Oakland, Santa Clara. There's a few places. They are declaring racism as a public health crisis. Now, of course, they need to take it a step further, right? Because we need to think about policies and those types of things and really combating this. But it's good that our country, we're starting to recognize how being Black in this country is impacting our health and our well-being, unfortunately. And not that because we're born Black that's a problem, right? We know that that's not what I'm saying. What I'm saying is how we're being treated and what's being done to us, right? The systems that are around us that are not being dismantled. This is what's causing the public health crisis, the racism. Believe it or not, and we're all educators, our education system is one of the main conduits of institutional racism. One of the main conduits. Imagine that. We work in systems that are upheld, unfortunately, by institutional racism, right? Systemic oppression is embedded within our schools, right? Almost as if there's a modern day segregation within our buildings, right? And I'm not going to say every single building. I'm going to say system-wide, okay? Justice for Breonna Taylor. When we think about our schools, let's think about a few areas that are pretty much blatant, but haven't really been touched upon or changed systemically. Suspension and expulsion. Why is it that our Black students are being suspended and expelled at higher rates when compared to their white counterparts? When we think of gifted education and honors programs and courses, why is it that our Black students are being regularly excluded from these opportunities? Special education. Why are our students being overrepresented in special education and remedial programs? School to prison pipeline. Why is it that Black students are typically, again, those students who are being suspended and expelled, and conversations about SROs, which is for another presentation, but why is it that we are constantly the ones, our students are constantly the ones that are connected or being impacted by the school to prison pipeline, right? Teacher bias, right? Because it exists. Why are our Black students being judged? Why are our Black students being treated in a certain way just because of the color of their skin or where they come from? Promotion and tenure, right? When we think of higher ed, why are our Black instructors and our Black professors being left out of promotion? Why are we not getting promotion and tenure when we're working hard, if not twice as hard, as our white counterparts who are getting promotion and tenure? When we think of college and career readiness, right? Because that's what we do, right? Why are we not thinking about the fact that kids in our communities, in our low socioeconomic communities, our Black and brown communities, why is it that we don't have the same access to resources and opportunities as our white counterparts, okay? And why is it that we as Black individuals who are being oppressed, why is it that we're expected to teach others how to treat us? Right? Why are we responsible for teaching others how not to oppress us? Just saying all that in like the last 2 or 3 minutes, that was stressful. It's heavy. It's heavy. And ASCA says that our work as school counselors is to engage in collaboration and advocacy, and that we are working towards creating systemic change. But folks, let's be real. Dismantling these systems are hard. It's hard because we're up against a machine. And this machine is deep rooted, and it's been running and trucking along forever. We're weary, we're weepy, we're exhausted, okay? This work is burdensome, and many of us are doing it alone. I mean, granted, we do have some allies, but a lot of the burden rests on us. So how are we able to really show up for our students, again, when we're carrying everything else when we're coming in with this baggage, right? So again, I know that I said, why self-care? But maybe I should have said, why not self-care? Just given everything that we are experiencing now and giving all that we experience as school counselors in general and the work that we do, self-care is definitely needed. So part 3 is really more so about how do we assess self-care, right? So now we're narrowing it in a little bit more, and we're going to get to that workplace wellness in just a minute. Where does the conversation on wellness begin, right? So a colleague of mine, Joanne Osias, says that self-care is really a mindset, right? And in one of her workshops, she talks about culture and how self-care is embedded in what we do or not embedded in what we do. Sometimes at home, so for younger people, they learned about self-care at home through their parents and their immediate communities. Some of us learned about self-care maybe going through our K through 12 school experiences. I know for me, I first heard about self-care in grad school, and I only heard about it in small doses. So it wasn't until I got into my doc program that I really started to learn a bit more about self-care. All right, so that's what, like 20 years later, after kindergarten, I learned about the importance of self-care and why it's needed in our profession. Of course, some of our communities and our societies, but some of us have never had these conversations about self-care. Some of these conversations about self-care are not necessarily consistent and not necessarily prevalent in what we do. I found that in my travels, when I go overseas to travel, work, and those types of things, I find that those other countries and those other communities, they value self-care. When I come back here to the States, it's like work, 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 work. It's just work. Everything is work. Everything is productivity. And if you're not working and you're not productive, then something is wrong with you, right? But there's never any conversation. As much as we talk about being productive and as much as we talk about contributing to society like we're machines and we're robots, the conversations are not balanced when it comes to self-care, when it comes to wellness, right? And that's just across industries. We're not talking a lot about wellness and self-care as much as we're talking about work. And I believe, and I mean, I come from a household. My mom was a single parent, and so she worked. She worked 2 jobs to take care of my sister and I. And so self-care wasn't necessarily an option. Paying the bills and making sure that we had our basic needs met, that was that's what was the main idea of our household. And so in being raised in that type of household, for me, I've always thrived off of being productive. So much so that I've always worked and gone to school full time. Or I've had 2 jobs and went to school part time, but I'm always doing multiple things. And never once did I think, oh, wow, maybe I do need some sort of self care. Maybe I do need to kind of not, and it was maybe. It wasn't even, I have to. It was like, well, maybe I should think about it. Maybe I should go to the gym. Maybe I should do, and it caught up with me in my doc program because I was working 2 jobs and I was taking full time. I was on a full time schedule and I had internship. I was doing the most. I wanted to graduate, but I wanted to keep my job, make my little money, all that. It was crazy. And I realized that after that, I needed to really kind of scale it back. But we shouldn't have to wait for those experiences, those overload experiences, to be able to have conversations on self-care. That's something that we need to do right away, and whatever it is that we do. So what I'm going to do is I am going to copy and paste this self-care worksheet. Now, there are other worksheets and assessments that are available. I am going to copy and paste this one into the chat area. What I would like for you all to do is just take a couple of minutes to kind of review it. Uh, we don't have time for us to really sit down and it's a Word doc. We don't have time to sit here and go through every little single piece. But what I want you to do is kind of look over it, kind of review it, and look at some areas in which you think that are your strengths, and then I want you to look at your areas of need, right? So your physical self-care, is that a strength for you? Is your psychological self-care strength, but maybe your emotional self-care is an area of need? Because in order for you to really start kind of look through some of the areas, and again, kind of identify those strengths and then those areas of need. I used to work physically in the schools. I always said to myself, man, if I work from home, I'd be going to the gym with those 30-minute lunch breaks for many of us. That isn't enough. Maybe it's enough to kind of smell your food. I've identified that physical self-care is that kind of engage in a bit more. But in terms of psychological self-care and my emotional self-care, I've been doing a great job in making sure that I tap into that. And really telling myself, removing I should from my vocabulary and saying I will. Because when you give yourself an option and say, well, maybe I should or maybe I shouldn't, you're not making it a priority, right? You're kind of weighing it on a scale to see if you should or you shouldn't. But when you say you will and you do it, it becomes a priority for you. And so those are mine. And of course, some of you may have different areas of need. After having this conversation with colleagues and students, here were some barriers to self-care and improvement that were highlighted in those conversations. Some people, when it comes to time management, that's just a weak area for them. And so I've heard some people say, well, I don't have time to do this, and I don't have time to do that. I got work to do, right? Or my schedule is just so packed and I'm not necessarily organized in a way where I can embed self-care into my schedule. So that ain't gonna work for me. Some people think that you got to have money to really engage in good self-care, right? Which is definitely one of those misconceptions, because self-care does not have to cost a thing. There's a lack of awareness sometimes regarding the need for self-care. So believe it or not, some people don't realize until it's too late that they actually need self-care, right? And some people don't know where to go or what resources to look for when engaging in self-care. So that lack of awareness is real. There's guilt. I felt guilt a time or two, especially as a school counselor. Oh, well, this child has an issue, but I really need to use the bathroom, and just trying to figure out, and not to make a joke about it, but just in general, feeling guilt because you recognize that if you take time to invest in yourself, sometimes that means that you're taking time away from doing something else. Okay. Sometimes self-care can be looked at as lazy or a sign of weakness. And so I've heard colleagues, oh, I don't need self-care, and that's just an excuse to not do work. No, it's not. It's a part of the work. It's a part of that balance, right? It doesn't mean you're lazy and it doesn't mean you're weak. What happens though is that when you don't engage in it, you won't be able to be productive in the ways that you want. There's also a lack of support sometimes, especially when you have those administrators who are really looking for those results and they really want you to engage in this work and they really want you to do this stuff. And you may tell them, well, I need some time for self-care, Mr. Johnson or Miss Jackson. Do you think I could take maybe a half a day off or something? And I mean, a lot of us are not asking for permission. Many of us are just taking those mental health breaks and those mental health days, which is fine. But sometimes we're afraid to have these conversations with our administrators because of the backlash and the lack of support we know that we're going to receive. And of course, again, we spoke about this with society and so on and so forth. It could be just cultural things. I told you in my household, and I'm not speaking for the entire Black community. I can only speak for what happened in Bed-Stuy in my apartment on Bedford Avenue. That culturally, productivity reigned supreme over self-care. And so for me, self-care didn't become a conversation until I hit my 30s. So I spent 30 years, like I said, 20 something years after kindergarten, right? And of course, and I mentioned kindergarten, I keep mentioning K through 12 education because that's when we really start doing the work. No, I don't have a full-time job where I'm paying bills, but school, K through 12, that is a full-time job for kids. And so just like I am working and doing my homework and passing these exams, yeah, mom, I need a little break too. And again, for some of us, that's just not an option. I'm going to copy and paste this self-care action plan into the chat area for you. This is just one example of many. Some of us have planners, some of us have apps on our phones, we have other resources that we can use. But this self-care plan really looks at all of those areas that we just kind of looked at in the assessment. And after really assessing the barriers and those things that are interfering with our self-care, that's when we begin to re-examine how we can support self-care and really think about different ways to do that. For me, I like writing things down because I'm able to retain when I'm writing. And I'm able, that accountability is there. I'm able to look at what it is that I'm doing, and I'm able to kind of follow that schedule. So me, I'm a writer. I have to write things down or type them up. This self-care plan, I like it because it looks at overall balance. And again, it touches on those barriers. So if we're saying that one of those barriers is time management, right? We need to talk about what negative strategies we can avoid regarding that time. So overloading ourselves is something that we need to avoid, right? So that way we can get to do these things that we need to take care of ourselves. So again, this is just one example of many, but I'm going to go ahead and put it in the chat area for you, so that way you can have it as well. And again, it's a Word document, it's a fillable. So all you have to do is download it to your computer and you can kind of type in it or print it out and write on it. So now we are bringing it on home to really talk about strategies in the workplace, our professional self-care. And again, remember, I told you guys in the beginning, your workplace may not be that office, right? Or some of us have experienced the closet space that we're given. Me, no windows, no air. One of the strategies, one of the top priority strategies for me after years and years of not engaging in self-care was making sure that my basic needs were met, making sure I ate lunch no matter what. And if that meant that I had to get up and leave my office and go sit up in my car or go to a nearby restaurant or spot to eat so that way I could eat in peace, then that's what I did. Because I found that when I was sitting in my office, I got food all in my mouth and, trying to clean myself up. You got students and teachers and everything happening. I can't even eat, right? Making sure you have water, air, fresh air makes a difference. I used to leave my job sometimes feeling so depressed because I didn't have any windows. So there was no light. There was nothing. I was just, again, there was just four walls. Movement, getting up and moving. And I know I mentioned it twice before, but using the bathroom. I can remember as a teacher, kind of moving around and almost dancing, because if my para wasn't in the room or if I didn't have a co-teacher or someone there to kind of relieve me or to help me, I had to kind of wait. And sometimes as a school counselor, that happens too. We teach classroom instruction. Sometimes we have groups and we have individual sessions, right? But when nature calls, nature calls. That is a basic need, right? And it's a need that food and water, all these things are things that we often take for granted. So making sure that you fulfill those basic needs should be key, because that's going to really help you reach that optimal effectiveness that ASCA talks about. And it's good for your health. Scheduling, right? So we just talked about writing things down. As school counselors, we know we have a laundry list of things to do. So why not write down 2 to 3 priority items that you want to tackle and accomplish for the day? I say 2 to 3 because once it starts getting higher than that, you can't make everything a priority. And then it becomes consuming and overwhelming. And so if you can just look at your 3 top things that you want to accomplish no matter what, even if you have other things on your list, that's fine. Additionally, for those of us who work from home or will be working from home full-time come fall, you are going to have to set some boundaries to make sure that within your schedule, you're working and you're doing what you need to do. But outside of that schedule, you have to be mindful of answering phone calls and work-related emails after hours. All right. I hear a lot of people say, yeah, I get my emails. They come straight to my phone, or, students have my telephone number, a parent texted me and, so-and-so and so. We have to be very mindful of that. When I first started working from home, I had issues with boundaries. in terms of the emails, answering emails late. So when every time students emailed me, I'm emailing them right back. And on Saturdays and Sundays, I'm with family. You know, maybe my husband and I are going somewhere. I'm in a passenger seat sending emails out. You know, we have to know when to cut it short, okay? And although many of us say, well, what if my student has an emergency? Well, the great thing about counseling is that you're empowering your students and your clients. So if you're unavailable, students and clients and families should have information to other resources that can assist them when you are not available. You cannot be everything to everyone all the time. Right? And so we have to recognize that care is going to be important for us, and we have to be able to put a stop to things. You can't work all day, every day. There has to be some balance in that day. And it's hard when you work from home. I'm telling you, I've dealt with it. But once you establish that tone and that routine and setting those boundaries, it does become a bit easier. Make sure you're valuing your time. Make sure you're valuing your money and the resources that you have to give. Weigh your pros and cons before taking on additional work. Many of us outside of school, with school counseling, sometimes there's options to do additional work like committees and programs, but some of us who are school counselors also have other side hustles and other gigs to help us make money, right? Because we know that we're underpaid. But I say to value your time, your money, and your resources, because if you're taking on additional work, how are you going to be able to get to those priorities, those 2 to 3 priorities that we just talked about? How are you going to be able to get to those priorities if you are overwhelmed and consumed with additional work? So being able to really look at, okay, what can I do? What can I not do? What can I save for later? So making sure you weigh pros and cons in those areas. I'm going to tell you that this social support thing can be really, really tricky. Okay, social support is important for that workplace wellness because your colleagues are also experiencing a lot of what you may be experiencing, right? But then there's also like a fine line when it comes to like complaining and venting. And when you're going to your colleagues for social support, you don't want it to become a complaining session because then you're not being supported. Right? It's just more stuff that's weighing on you, more heaviness. So I'm not saying that you can't vent. I'm not saying that you can't have those conversations about what's happening, right? But move beyond the venting, move beyond those conversations. Those venting conversations are needed. They are very much needed. But then you have to think about, okay, what happens next? What am I going to do? Because that's what that support can look like. Of course, it can look like just a listening ear or a shoulder to cry on and no suggestions, no advice, because some of us just need that. We just need somebody to listen to us and we go on our way, right? But you also don't want to go to get support and your colleague is just putting things on you. It should be an even exchange. It should be reciprocated, right? And you should also be talking about action steps and ways to really combat a lot of that workplace stress. Those should also be a part of the conversation too, right? Not gossiping and, oh yeah, because this teacher came in late and the principal didn't say nothing to her because that's her favorite, but she gonna say something to me and I was 52 seconds late and I had to stop because there was something in my trunk and the key got jammed. And no, because that's not gonna help you and it's not gonna help your colleague either. Organizing your workspace. I feel seen. Because I have issues with keeping my workspace organized. Because my mind is often cluttered with so many things that I have to do, so is my desk. And I find that when my desk is clear, I find that there's some sort of mental clarity that's connected with that. I'd be like, all right, Q, I'm good. I got this stack over here. I did this. I feel good. I feel productive. But when things are all over the place, I feel like a hot mess. Okay? So organizing your workspace, whether you're home or at your school building, is going to really be important for your mental clarity. And you may want to put up some pictures. You may want to put up some positive quotes and words of affirmation that you can reflect on in your office space or in your workspace. For me, I had an oil diffuser and essential oils. And I bought it off of like Amazon, and I get my oils from like Walmart and Target. And I used to have that in my office. And even when people came into my office to see me, it just brought about a sense of calm. And so again, you can decide to organize your space in whatever way you choose, whatever is going to benefit you. But I can say that for me, definitely when my workspace is organized, it does help bring about that mental clarity. We spoke about the mental health break and the mental health day. Folks, we have sick days at work.
And sick days aren't only for physical health. Sick days is for emotional health, psychological health, whatever health you need, right? I know that, especially with the rise of social media, when I first started in school, social media, there was no social media. But as social media continued, some of us are friends with our colleagues on Facebook and Instagram. And I would hear certain colleagues say, oh, well, Miss Jones didn't come to work today, but I see she posted a picture online and she got a new hairstyle. Okay, well, maybe that's her self-care. Leave sis alone. Let her do her. Right? If going to get her hair done and going to get her nails done, her mani and her pedi and all that good stuff, if that's her self-care, let her be. Just because someone is taking a sick day doesn't mean they're coughing up a lung, right? And so making sure that you keep those internal and those external critics at bay. Don't let anybody tell you that you should not take a mental health break or you should not take a mental health day, because you need to still be able to do the work that you need to do. All right? Imagine you're stressed and you're coming to work, and these same people who are your critics, they need you for support. Now you're not able to support them. Then they'll be talking about that. So it's damned if you do and damned if you don't. Keep the critics at bay and take care of you. I know that we don't all have supervision. We don't all have access to supervisors. We don't have access to clinical supervision, many of us as school counselors. But I'm going to tell you, just seeking support from a senior member of the profession, it could be beneficial to your professional and your personal wellness at work. If you're dealing with a student issue, whether it be crisis or what have you, and it's really weighing you down, and you need to be able to process that with someone who may have experience in that area, may know how to navigate those things. Talk to a supervisor. And again, it may not be an actual clinical supervisor. For some of us, it may be a more senior member of the profession that can really support us and mentor us. And that's truly important as a professional. Of course, I'm an advocate for supervision. And I just think that as school counselors, especially in the world that we live in, supervision post-graduation is needed now more than ever. Last but not least, counseling. We're school counselors. We know the value of counseling. We know how beneficial it can be. Counseling changes lives, okay? And for those of us who say, well, oh, I'm not going to go to counseling. I'm going to just go to church. You know what? I'm a Christian, okay? I can love Jesus and love my therapist too, right? We can do both, all right? And it's important to be able to go and process certain things with someone who is non-biased, non-judgmental, and someone who can really support you and help you work through things. And it doesn't have to be because you're impaired. And it doesn't have to be for extreme mental health cases. Some of us go and see our therapist for maintenance, right? Then you may not even need to see a therapist every day or twice a month. It may just be once a month. But you have to be able to invest in your self-care and your wellness before you can invest in someone else's. So I'm going to tell you, all of this being said, we have to be able to shift our mindset, because it starts with here. It starts with what we're thinking. When self-care is a natural part of your routine, folks, like you're eating and you're sleeping, hopefully those are natural routines, it's not going to feel like a chore. It's going to feel like a personal responsibility. And as our wonderful hosts say in our group, Professional School Counselors of Color, be the change you want to see. If you want to engage in self-care and you want to see that around you, create a culture where self-care is the norm and is promoting wellness for all that are around you, including your students and your colleagues. I remember a social worker going into the different classrooms and doing chair yoga with some of our kids after recess. And so students looked forward to chair yoga with the school social worker. Excuse me. And then after school, she would have these mindfulness sessions with the kids. And it was so uplifting and just so great to see, because a lot of our students and families, they didn't know about these things. The school wanted to have a detention room, and she was totally against that, and created this wonderful mindfulness program, so much so that the program became packed, and students and parents had their students on a waiting list because they wanted their students to be a part of it, but the school social worker could only take but so many kids. And so creating that culture is going to be beneficial. Again, setting boundaries, prioritizing that self-care, so those critics and those things that impede your well-being, those threats, they're pushed to the side. Don't limit yourself to that one self-care day. I'm gonna do self-care Saturday. No, I'm gonna do self-care Sunday. No, don't limit yourself. Why not embed self-care in every part of your day? It's possible. Think about it this way. If you have 5 days of work and you only have 1 day of self-care, you could already see how imbalanced that is. By the time Monday is done, screw Monday being done. By the time you're in the second hour of your workday on Monday, you're ready for a self-care day already, right? So why are we confining ourselves to one self-care day when we can find ways to embed self-care into our workday every day? Work on creating that balance. Self-care is not a spa day, folks. You do not need to go to the spa. I know people who make sugar scrubs and coffee scrubs with things in their cabinets in their kitchen. Okay, I know people who will just sit in the bath with some bubble bath and just chill out. Some folks would just opt to take a nap or go and have a nice meal. Self-care does not have to be anything glamorous and luxurious. I mean, of course, if you want it to be, yeah, but it doesn't have to be. You can always find creative approaches to self-care that fits your specific needs. I'm going to say this because I've seen this happen a lot, and I encourage my students to do it. So, I mean, I definitely want to tell you folks about it. It's okay to include your family and friends in self-care. Self-care does not have to be an isolated event. I love and enjoy hearing stories about educators and parents who involve their children in self-care with them, whether that's taking family walks, bike riding, going to the park. Not only are you modeling self-care for your children, you are creating a support system regarding your family, and you're increasing accountability, right? Because now your son or your daughter might say, well, mommy, we didn't take our walk today, or we didn't ride our bikes today, or dad, you didn't take me to the park today. We didn't get a chance to go exercise today, or whatever it is. So it increases that accountability. Last but not least, just to drive the point home, after everything that we've listened to today, self-care is not selfish. It is necessary. It is necessary for your personal and your professional well-being. Please take the time out to engage in self-care, not only just for optimal effectiveness, but to be the best you that you can be. Are there any questions or comments?
Thank you, Taqueena. That was awesome. I am unmuting folks if you want to mute and say anything. So if you want to say something, Heather, we can't hear you. I don't see Heather.